Yes, ma'am.
I work in the area of trying to get health coverage for people, and particularly in trying to get Virginia to take the federal dollars that are available to cover many of the working poor. And oftentimes they use this type of information to counter, well, see, healthcare coverage isn't really that important because it's all these other factors. And the only thing I saw on your list was, the mental health services. Well, of course, that would greatly facilitate mental health services if people have access to that. But one of the things that, recent studies have come out and shown is that income grows by $800 to, I believe, $600 to $1,000 per individual when they have, or per family, I can't remember exactly, when people have health insurance coverage, because they can move out of poverty, they stay well, they don't have the burden of extensive health care bills and things of that sort. So how are you all, how do you view this, and are you all using anything like this in your reports to really emphasize this issue?
Well, it sounds like a cliche, but thank you for that comment, but I literally mean it, because that the absence of access to health care on that slide is because it dropped below the bottom of the box when we were making the slide, but it is hugely important. So we're not speaking out of two sides of our mouth here. We think about health, and I'm a doctor, okay? We talk about health care and access to health care as something that's necessary but not sufficient to improve health outcome. But widening access to care, both in terms of broadening health insurance coverage, making health care more accessible and more affordable, especially to disadvantaged populations, is essential, because no matter how good your social factors are and your environmental factors, no matter how healthy your community, you're going to get sick, and you also need preventive care to keep yourself from getting sick. So I don't disagree with you at all, and your point is absolutely right that healthcare costs, along with transportation and housing costs and child care costs, are taking a real pinch out of family budgets, so that they are struggling with food insecurity and a lot of other problems because of that. So definitely necessary. However, I'm just responding to the reflex that we have in our society that assumes that health is all about health care, and that if we provide health insurance coverage and access to care and make it affordable, we can check off that box and move on to some other issue, when in fact that's only going to affect about 10 to 20% of our health outcomes. Other questions? Oh, yes, sir.
Good morning, Donnie and John with Novus Group Central. You talk a lot about education and how that's a big impact, a factor to determine success, and specifically college education, a bachelor's degree. But when you look at millennials, a lot of them are graduating college with a degree, but they have no jobs to fulfill their lifelong passions with whatever major they have. So will you look in the future to determine just a college education alone is not a perfect indicator of success, but more of workforce development or more vocational schools, how that can help move groups together forward? Because once again, a lot of people graduate in colleges with high college debt, but no jobs to equate to make up the coverage of that debt. And outside of medical bills, college debt is probably the #1 reason for people to go into personal bankruptcy.
Well, 2 points to make, and thank you also for that question. 2 points to make in response. I think it's important for me to rephrase that as post-secondary education, because we feel that a lot of opportunities are being lost by not routing enough students into vocational schools, community colleges, associate degree programs that would often be an excellent fit for them and offer good job opportunities. I myself got my start in community college, so I'm an advocate for that. But the other part of it is that both the financial struggles of college debt and the lack of good jobs for college graduates are, in my view, symptoms, pardon the clinical analogy, symptoms of the larger struggles of the economy. It's part of the current frustration that Americans have about the economy not working for them, that the top 1% or whatever are doing quite well, but for others who have received a very good education, have done all the right things, are still having trouble finding jobs that are going to support their families and allow them to have the economic growth that the previous generation enjoyed. So the solution is economic efforts to strengthen the economy, to increase job opportunities, and create an environment that provides good employment for those college-educated adults. So the problem is not college education. The problem is an economy that's not providing paths for success for them. Well, thank you much for your time.